I'm Dr. Ben Talei. I'm a facial plastic surgeon in Beverly Hills. Today, I want to talk about something interesting. As a facial plastic surgeon, we deal a lot with kind of the psychiatric aspect and the decision-making of what to do for patients and when it's right. This becomes even more difficult when we're dealing with parents and their kids. And it's not unlike when you have a parent who takes their pet to a veterinarian. The animal, it's a weird comparison, but they do in pediatrics. They can't always speak for themselves. And in this case, you have children who don't really know what they want or what's bothering them. And the parent, they have to make the decision all by themselves. And that makes it very, very difficult because they can't really share the choice with the kids. So this we see a lot in plastic surgery with birthmarks, deformities, things that kids are born with. And my second fellowship after facial plastic surgery was birthmarks, lasers, things like that. And kids can be born with different kinds of deformities. Birthmarks, we're used to seeing the little cherry spots that we call hemangiomas, but certainly they can be bigger. They can have big ones that grow out of the face, grow out this way, make your lip grow out, even have a giant mole on the side of the face. I myself had a birthmark when I was born, and it was in my airway. And I had that taken out because I couldn't breathe. So that was an easy choice. The difficult choice becomes, what if this is something that we see as cosmetic? And I have parents ask me, or ask me before all the time, what do I do, doctor? I don't know what to do. My kid has this mark in the middle of their forehead. Is it going to affect them growing up? And I tell them, well, there is a low chance of malignant potential, meaning, yes, this thing can turn into a cancer. The chance of that's like 1 in a million. So we're really dealing with cosmetic deformity. Does a cosmetic deformity really alter the course of the child's life and development? And the answer in many cases is yes, it can. So after 4 years of age, we deal with recognition differences, meaning a child can recognize differences in other people as well as their parents and things that they wouldn't notice before. And this would lead one child to interact differently with another child. What that means, if somebody has a birthmark, a little kid, other kids might start noticing it and might start pointing it out. And of course, if we're 13, 14, 15 years old, maybe we've learned to deal with this and cope with this. We have strong personalities. As a child at 4 years old, 5 years old, when people start picking out those differences that are noticeable and kind of in your face, literally in your face, other kids might react differently towards them, and that might really affect their development. So these kids over time become somewhat introverted. And not unlike being on the spectrum of Asperger's, some of these patients become like that, where they really become shy, introverted, and it's difficult for them to communicate with others because they're always worried about interacting in a strange way or people judging them and looking at them. And I tell the parents, it's a difficult decision. Your kid's not gonna be able to help you out. The thing that I would say is don't worry about 15, 20 years from now, the kid looking back and saying, you didn't love the way I looked. I can't believe that you did this. Why would you do a cosmetic surgery on me when I was a baby? Did you think I was ugly? That realistically doesn't happen. I haven't seen it happen. It's possible, but the chance would be very, very low. Although I do say that more commonly when kids have larger marks on their face, if you don't take care of it at a young age, they may develop these issues. So I leave that really to the parents to choose what to do. If I don't think it's going to cause any other functional deformity, I don't see a medical need to do it, but it can affect their emotional and interactive development with other teens. If, of course, there's a deformity that's going to cause impairment of vision or trouble with speech and drooling, which you do see very often, then yes, I advise them you got to do it. And you have to do it at an early age because kids heal incredibly well before 3, 4 years old. Once they get to like 5, 6, 7 years old, it's okay. 10 years old, they're an adult, they heal like an adult. So I really take advantage of younger healing, I'd say, if you don't want scars to show up.